Welcome to the Voices for Voices TV show and podcast, sponsored by Redwood Living. Thank you for joining us today. I am Justin Allen Hayes, founder and executive director of Voices for Voices, host and humanitarian. You can learn more about Voices for Voices on our Instagram, Facebook, and YouTube channel at Voices for Voices, or also on our website, voicesforvoices.org. Voices for Voices is a 501c3 nonprofit charity organization, otherwise referred to as an NGO, a non-government organization. And we survive solely on donations. So if you are able to, please consider heading over to voicesforvoices.org to help us continue our mission and the goal and dream of mine to help 3 billion people over the course of my lifetime and beyond. Or you can also send a donation to the mailing address of Voices for Voices, and that's at 2388 Beckett Circle, Stowe, Ohio, 44224. Or you can also reach us on the Cash App at Voices for Voices. Are you or somebody you know looking for a volunteer opportunity? If so, you can reach out to us today via email at president@voicesforvoices.org. Now, I founded Voices for Voices to provide a platform for folks to share their stories with others as we work to break the stigma around mental health, accessibility, and disabilities, and also helping people get the help they need and helping them prepare or transition into the workforce with the Voices for Voices Career Center, where we connect talent with opportunity for both job seekers and employers alike, from coast to coast and in every industry and job level. And who can forget about merchandise? The Voices for Voices merchandise shop is up and running at voicesforvoices.org/shop, where shipping is always free, and again, all donations are 100% tax deductible. In today's episode, we are going to be focusing on mental health, addiction in the workplace, and recovery, and making sure or working towards getting individuals the help they need on the health side, but also on the career side. And that is going to have a big focus working with employers too, because many individuals don't work for themselves or have their own companies that they run or know somebody. So we're going to be focusing on that with our two guests in studio with us today. Today in studio from Cincinnati, Ohio, from the Hamilton County Public Health is Tyler Meenick. He is the Public Health Coordinator, again, at Hamilton County. And also we have in studio today Maggie Urban Walla. She is the project specialist at Summit County Public Health. And we're going to be talking, mostly our guests are going to be talking on what we consider recovery-friendly workplaces, what that means, what that is, how people can get associated with that. If you're an organization, how you can find out about it, how you can join the coalition, the positive movement, and help us continue to bring individuals who may have a incarceration record back into the workforce and the workplace to help them reintegrate and become and continue to be healthy members of society. So Tyler and Maggie, thank you for joining us.
Yeah, of course.
Thanks for having us.
You bet. Maybe we can jump in and talk about what is recovery-friendly workplace. What does that mean? And then Tyler, you can probably talk about the foundation, how it started for you, and the blueprint of how other counties like Summit County are starting to integrate that.
Yeah, of course. So you'd like me to go ahead and start off?
Absolutely.
Yeah. So the recovery-friendly workplace movement, I think if I had to give it a global description, it's about a new paradigm for stabilizing the workforce and also reaching a group of people who are otherwise haven't been reached in the past, who are suffering from substance use disorder and are in the workforce. On a local level, what I think of my job and what I think of the Recovery Friendly Workplace program is it's about acting as a liaison or a bridge between the world of treatment that exists in our various regions and the world of business that exists in our regions. There's a lot of research out there that indicates that somewhere between 70 to 75% of people with a substance use disorder are an active part of the workforce. We might have these cliched notions about people who are struggling with addiction, kind of living on the streets, making it one day at a time, not being an active part of the workforce, but the statistics would show otherwise. People are actively working, and if we want to be able to reach them, we need to reach them where they're spending a lot of their waking alert hours, which is at work, for better or worse. So it's a new way of trying to reach people where they haven't necessarily been reached before.
Fantastic.
Yeah, I think what I say a lot and what I think is that within the human services field, where I've worked for quite some time and a lot of my colleagues have worked for quite some time, we sometimes end up in an echo chamber. We all are kind of aware of the statistics. We all have the same goals. We have a lot of the same data. And so, by utilizing employers and the business community, we're able to reach a much larger audience to help remove some of that stigma and get people the care that they need by utilizing this untapped resource of, the business community.
Absolutely.
In the state of Ohio, my understanding is Hamilton County was the founder, but one of the founding fathers of this movement to get started. At other counties like Summit and other counties across the state of Ohio are starting to adopt. How did the interest in Hamilton County start?
Yeah. I wish I could take credit for the whole recovery-friendly workplace movement. I can't, unfortunately. And we're not really even the first in the state of Ohio, so I'll just kind of clarify that a little bit. Governor DeWine does have a program called Recovery Ohio. It is a self-attestation program, and they do have some good resources on their website at Recovery Ohio. But recovery-friendly Hamilton County was one of the big first counties to take on this initiative and model ourselves directly after the originators of this movement, which is New Hampshire. So for your viewers who aren't familiar, the recovery-friendly workplace movement really started in New Hampshire back in 2018. Governor Chris Sununu, who's still currently the governor there, is credited with being the brainchild of the movement. He was a former business owner himself. He worked at a ski lodge, go figure, in New Hampshire. And he saw firsthand the direct kind of human and economic impact that substance use disorder was having. So quickly brainstormed, put together a lot of smart people, and came up with a movement that could get the business world connected with the treatment world. So when I started at Public Health in November of 2021, the idea behind my job wasn't fully formed. It was about connecting with the workforce, but outside of that, there wasn't a very good, solid backbone for it. So I did some quick research and, came across RFW New Hampshire, got in contact with their administrators, and they are a great group of people, and they helped me model what I'm doing after their movement, and then I've been able in turn to help folks like Maggie start their own initiatives at the local level. So.
Yeah, and then in Summit County, how did the knowledge of Tyler's work in Hamilton, how did that really meet with what you were trying to do and the Summit County Health Department as a whole was trying to do? So how did that link happen here?
Sure. So my position at the Summit County Public Health Department and our recovery-friendly workplace program came almost exactly a year after Tyler's. So, by that point, I was able to see some of the work that he had already been doing over the course of that year. And it was very impressive, and it was something that I was interested in modeling ours after. None of us are that, creative or unique. We just have amazing people to, mentor us, as Tyler has helped mentor me with some of this program. New Hampshire, obviously, has helped all of us, and there's other places around the country as well who've been doing this work for for some time, and why recreate the wheel? What they've been doing has been working, and so I reached out to Tyler just to see where to begin, because it can sometimes feel a little daunting. Tyler works in a community that's much larger than mine, but I figured if I could try to replicate some of what he was doing, and try to reach people in a similar way that he was reaching them, that we could see some successes, and we definitely have so far.
And much as individuals gone through whatever they're going through, the trauma, the addiction, mental health, whatever those pieces are, just as that not only affects the individual, affects the community, in both of your roles, working as individuals, but also as part of the health department as a whole, that you receive support at some level to, yep, we're on the right track, keep continuing going. Can you talk about the importance of that support that you received, Tyler and Maggie, to really bring these to life instead of just making them an idea, like, oh, I talked to somebody in New Hampshire and we have this idea, let's do it.
Yeah, good question. My department, Hamilton County Public Health, they've been great. They've been championing this initiative from the start, even when it was just kind of birthed in a conversation during a meeting. They thought it was a great idea, and they've been behind it ever since. I will tell you that in order for us to promote this kind of program or paradigm, or however you want to refer to it, we decided at the administrative level that it would be best for us to first do some kind of self-evaluation and make sure that Hamilton County Public Health was in and of itself a recovery-friendly workplace. Okay. So we've done some policy evaluations, we've talked with our Board of Health, and I think that internally they've been great champions for it.
Okay.
Yeah, I think on my end with the Summit County Public Health Department, they were looking for somebody very specifically that had lived experience with recovery, and I'd also been working in the recovery field for some time. So they really wanted to bring somebody with that lived experience in who could lead by example and be somebody who was willing to say, hey, at a certain point in my life, not terribly long ago, I was somebody who was not able to maintain employment, who wasn't able to do the things I really wanted to do. Because I was hindered by, what was happening in my life at the time and substance misuse. So I really respect the fact that they, came up with this initiative, and obviously it's modeled after others, as we've heard, and that they were really interested in putting their money where their mouth is, with the Recovery Friendly Workplace program. We have peer supporters working for the health department. You've got myself who uses their lived experience to try to implore others in the community to see us as what we are, which is individuals who have been able to rejoin society and contribute in a way that helps others and helps break down that stigma.
Awesome. So employers that are part of the program now, as well as those that might be watching this or listening and want to join, what is the program at its core, and how can organizations find out and join that movement?
Yeah, of course. So we're going to kind of dig into the black box here of what this is all about. Yeah. So every county has some different offerings. Every state that runs a program like this has some different offerings. So I'll really let Maggie kind of take the wheel on that. I can tell you that some of the stuff we're working on in Hamilton County is building out some policy templates for people that really want to make some bold changes at the fundamental kind of policy level to render themselves more recovery friendly. So building out, let's say, a second chance or return to work agreement for people who may have misused on the job or test positive, and you don't want to stave them off. You want to give them a chance to rejoin and come back into the fold after they've undergone treatment. I do linkage to care through not only myself, but also through a partner organization. So one of the requirements we have is we actually ask our businesses to put on their premises these posters that will broadcast our local 24-hour hotlines and online resources. And one number on that poster is exclusive to this initiative, so they're able to call and get direct care and a warm handoff to a treatment organization, or the human resources professional can call me directly and say, hey, I've got situation with employee X. Can you make some recommendations, maybe talk to them yourself and help get them on the right track? So yeah, those are some of the things that we're doing at the local level, and our requirements, I imagine, are very similar to Maggie's since we're all kind of based on the same New Hampshire model. But since this is airing more so in this county, I'll let her talk about what they're doing specifically.
Because, you know, I reached out to Tyler for a lot of guidance on this. It is very similar. We're very fortunate at Summit County Public Health to collaborate very closely with the ADM board. We actually share a building. So if somebody did need help and was, you know, interested in seeking treatment or just interested in seeking guidance from somebody who that's exactly what they do, you know, the ADM board has that 24-hour number, and you know, has a really incredible response time with getting people into the care that they feel they might need. And so that linkage to care is a huge aspect of this. You know, the number that we kind of look at is that only 1 in about 10 of people who need treatment do end up accessing it. And so that's a number that we definitely want to increase. And because, like Tyler mentioned, people spend so much time at work, we want to make sure that there's a few things, that they feel comfortable going to their employer. You know, so in that case, we have to reduce that stigma within the workplace, make sure that employers, supervisors, HR personnel have gone through a stigma training, and they'll go through an orientation with myself, and Tyler has a similar process. You know, and then we also want to make those resources readily available. So I modeled my resource list after Tyler's, but it's obviously specific to Summit County. Say that person wants help, but they're not yet comfortable going to their employer. But they've got that resource sheet posted around the workplace, so they can go up and they can get that number for themselves. So there's a lot of things like that you know, like I said, are a lot very similar to the other programs that exist. We wanted to make the program as accessible as possible for businesses. So the requirements in order to receive your recovery-friendly workplace designation, it is, you know, relatively simple and easy to maintain or receive that initial designation. So, you know, you express interest, great. We go through the orientation, we provide those resources, and we want that employer to let their staff and employees know we're participating in this program, and so that declaration would be the employer letting their staff know, like, hey, we care about you. We want you to come forward and ask for help, and we are doing the work to make sure that when you do that, we're ready and we can get you that help.
Right.
Yeah, and I just want to point out one thing, because we're talking about the business community as a whole, which is largely private sector. This initiative on my end is free of charge, and I know on your end is free of charge. We might promote services with other entities that could cost money potentially, but the designation process, coming on board with us, getting the training and these assets is all free of charge.
That's great. The organizations that you're working with now, what drove them to want to come to you to partner, and are they happy with where they're at right now?
Yeah, so we've done a recent survey, and they shed light on favorability for us for our initiative. I'm happy to say that at this time we now have 34 businesses as a part of Recovery Friendly Hamilton County. And I think that on the one end, people that are kind of using sort of the lower tier of resources, just like having that social currency of being able to say you're recovery friendly, not only for the community at large, but also for your staff, just to let them know, hey, we care about you, we honor the fact that you're in recovery, and we are invested in your treatment if you need to come forward and, you know, acknowledge that there is an issue that needs to be resolved. So I think kind of on the low end, those are some of the things that they're looking for. And then on the higher end, I've got businesses who have contacted me and said, hey, we could use a training on reasonable suspicion and how to handle that with care, or we really do want to adjust our policies and could use some good resources for that, or, you know, we want to get connected with a treatment organization in our same zip code so that we can work with people to get treatment nearby. So I think on the higher end, I become sort of like a consultant for them, all free of charge, just to kind of guide them on how you do certain things and navigate the treatment community, because we can't expect people in the business world to know the treatment world the way that Maggie and I do. It's just, that's our background.
Yeah. How about in Summit County so far, getting off the ground, and moving in the
Sure.
first few months?
So it is definitely still early days, but we're excited to have our first, handful of businesses that have become designated. And, I love to use our first business that came on as an example. Earthquaker Devices is based in Akron. And they were a wonderful business to start this with. I learned a lot from them, just as they learned a lot from me, and that is kind of a cool part about this collaboration between us and these businesses. It was interesting, like I said, I learned a lot in terms of having that initial discussion with them, where they talked about why they were interested in doing this. And whether it was from experiences or really caring about the recovery community, wanting to make sure that people that worked for them knew that they supported them, wanting to know how to help them better, is definitely, I think, a lot of those things that were fleshed out in that first relationship. And it's now something that I carry over with other businesses that I work with. A lot of times these businesses haven't thought a lot about these things. They'll have a policies and procedure manual. They may have had experience with employees who did need to seek treatment, but we're kind of going in there and we're opening up these deeper conversations with them to say, here's a scenario, and here's maybe some ways to handle that scenario. And those are things that, they didn't think about, or it's things that they're interested in but need to know how to put it into practice. And so it's been really great seeing how these businesses come up with unique ways to address this, because we don't go into these businesses and tell them, you have to have this policy, you have to change this, you have to hire this person. We go in and we tell them all the wonderful reasons that exist to put those policies into their procedure manual. We help them with ways to get reimbursed for certain things, such as coming up with a way to alter their procedure manual and to receive funding for trainings and different things like that. So it's been a really symbiotic relationship so far, where we're all learning from each other. And as I grow and as I learn more, those businesses definitely reap the benefits as well. And so, like I said, it's early days, but I'm very optimistic based on what's been happening so far.
Yeah, and I think I speak for both Maggie and I when I say to those businesses directly, I don't know that any of mine would be watching, but reach out. We can't help you unless you're asking for the help that we can offer. For sure, we love that. We're very enthusiastic whenever we have a chance to come in there and do some brainstorming.
And from conversations and overhearing some conversations, having individuals in care, their absences are down, productivity on average is up because they're seeking care, so they're not taking extra time off to work on their habits and those things. And I think employers should, as most employers probably do, they're in business to make money,
right.
And so they want to sell the most things at the lowest cost, and you want to have people there to do the work,
right.
And so that I think is an incentive to do that, and especially with certain manufacturing industries having a hard time finding certain laborers, individuals to do the work. This is another great asset that an organization can implement to tap into a population of workers that is there.
Yeah, I think that this movement is just as much about the humanitarian side of things as it is just about the bottom line and economic, stimulation. There's a lot of research out there to suggest that people in recovery yield a lot of advantages to business. They, on average, absorb less healthcare costs than the average worker. They miss fewer days of work, and they tend to be very motivated, driven employees who tend to stay in positions longer than the average employee.
Yeah, to be cared about, just that fundamental human need.
Yeah, so we're talking about a few different things with this program. or touching different communities. We're talking about the recovery community, so individuals who have been able to get to that point in their recovery where they're ready to re-enter the workforce, or whatever aspect of society it is. Maybe it's volunteer work. We're also touching on individuals who have been gainfully employed for some time, who may encounter a substance use disorder, because as we talked about in other episodes, it doesn't discriminate. And so at any point somebody could end up with a substance use disorder. So we're talking about getting people in recovery work. I know for myself it was huge for my recovery to go into work every day and have something to get up for in the morning, and to see myself actually accomplishing things and getting promotions at work, and being a team member that people came to for support, and being somebody that was singled out to oversee this kind of program.
Right.
Those kinds of things are invaluable, and they had a huge impact on my recovery, and just building up that self-confidence. Being able to talk openly about my recovery. This is such an amazing opportunity for me to be able to go into a workplace and say, I really strongly recommend that you are, become open to hiring people in recovery, because I'm one of those people, and I can confidently say that I'm an asset to the team that I'm a part of today. So that is something that this program can do, is get people in recovery, jobs. And we're not asking employers for any favors by doing that. We're telling them and showing them that it's, in their best interest to, open up their hiring to these kinds of candidates. And so, by getting people into treatment that need it, by getting people in recovery work who need it, those things all contribute to improving that bottom line. So it's another part of that kind of symbiotic relationship, where if you have a healthier workforce, your bottom line is going to see improvements as well.
Yeah.
I love it. What haven't we touched on regarding the recovery-friendly workplace, the program? Is there any areas that we haven't touched on that you want to make sure we do?
I'll make a quick mention, then I'll segue right to you, because I know it's a note that you want to hit on. But both of our respective departments do offer harm reduction supplies like naloxone, fentanyl test strips, and we do encourage our businesses to keep naloxone on site as a supplement to their first aid kit, because you simply never know where an overdose could occur, and you'd rather have it than not have it. So,
yeah, we offer a lot through this program. A lot of it is resources. We definitely provide resources. Anytime I learn something new from Tyler, who learned something new from someone else, we're able to pass along that information. And then the more tangible tools and resources that we offer are that, naloxone, so we can get businesses, companies, agencies their own supply of naloxone. We get them training. So I've gone in, and at the same time that I'm doing the recovery-friendly workplace orientation, we'll do an all-staff Narcan training. And everybody in the room gets to leave with their own box of Narcan, and everybody in there is more prepared to respond to an overdose were that to happen around them. And that could be in their home or in the business. So we're getting more people trained on how to administer Narcan. We're getting more Narcan into the community. And then what we are able to offer in Summit County is nalox boxes. Well, that's what we refer to them as. They're an opioid response kit. So it's a first aid kit basically for an opioid overdose.
Okay.
And a nalox box, it's a small, box, and it holds 2 boxes of Narcan. Each of them has 2 doses inside. And so we've been able to get over 70 nalox boxes out into the community, a lot of them in private businesses. So these are employers who said, you know what, I of course I want to be more prepared. We have an AED kit, why not have a nalox box? And that's what we're trying to emphasize, is that overdoses can affect anybody, and it's always better to be prepared. So it makes sense to have a first aid kit, an AED, and a nalox box, all right there, just in case. What was probably mentioned before is, Project Dawn, which gets naloxone out into the community. And so Project Dawn was created because we don't want there to be an overdose, a fatal overdose that occurs in the community that could have been prevented. And so the more naloxone that's out in the community, the better. We know that most overdoses happen in private residences, and we tackle that a certain way, but this is one way to tackle overdoses that may happen in the community. And so, an employer having a naloxone box in their workplace, that is recovery friendly. They are saying we care about our workers, we care about our community, we acknowledge that overdoses are happening in our community, and we care enough about our workers to make sure that we're prepared for that if it were to happen.
Absolutely.
Great. Tyler, Maggie, thank you so much for joining us, sharing awareness about the recovery-friendly workplace, what it is, how to get involved, and the importance to not only the individual seeking that second chance in employment opportunity, but the organizations, and it is truly a benefit as for the business as well as on the humanities side. So thank you for joining us.
Thanks for having us.
Thank you for having
Absolutely.
us.
And thank you, our viewers, our listeners, those checking out our transcript, for joining us on this episode of the Voices for Voices TV show and podcast. And until next time, I am Justin Allen Hayes. Have a great day and be a voice for you or somebody in need.